All the tummy. Hello and welcome to our Friday webinar. We are on with Dr. Lamb and a special spring special guest there. Welcome, Dr. Lamb and Artemis. Yes,
Artemis. Yep.
Artemis the chicken. Good to see you, Artemis. So today we're going to cover mycobacteria. So an important topic that I'm sure you have an excellent presentation, a PowerPoint, right? I made you co-host so you could show that. And welcome everyone. If you're joining us, let us know. I'm sorry, you are joining us because if I'm tell us where you're coming from. And let's see. We'll get started shortly. I'm sure you've got a lot of territory to cover. And tell us why you have your chicken with you, because you just show up with the chicken. You got to say why.
She just wanted to come along. She's a, indoor and outdoor chicken. She mostly is outside, but she comes inside too. And she was really, the reason she came is because she's knocking on the door, which, tells me she wants to come inside, but I had to go to work. So I was like, all right, you can come with me to work. That's fine. But she's an old girl. She's 9. She despite being 9 years old, still gets into lots of adventures. She had cataract surgery. I know I told you guys about it before. A few months ago, she had cataract surgery because she had cataracts in both her eyes and she was blind. And I was like, well, she wasn't moving around as much because she wasn't able to see, so she was just sitting around, not exploring as much. And I said, well, I want to get cataract surgery on her so she can start to explore more. And apparently she heard me say that because she explored this last week. She went under my fence and explored along the neighborhood and was hanging out with one of my neighbors for a while. So, but she, she had her little fun, and now she's back home and she cannot get out from underneath my fence again. I made sure that that wasn't going to happen.
Wow. So you say you're knocking on the door, you mean she's like pecking on the door with her?
Yeah, she'll go up to the back door and she pecks at the door. So that means she wants to come in. So, okay, you can come in.
Oh my gosh, well, it's great to have her. Great to have her along with us today. She wants to know about mycobacteria apparently as well.
Yeah.
So, all right. So if you're, I'm sure we'll, if we have time for questions, we'll do those at the end. And if you do have a question, make sure to use the Q&A button for it and not the chat feature. And I'm gonna let you get started because I know that these are so involved in your PowerPoint. So,
All right. Well,
yeah.
let me go ahead and share my screen. I'm gonna get this PowerPoint up and going. All right. So we're talking today about an infectious disease called mycobacteriosis, and it's kind of one of these little more weird diseases that you hear about sporadically. They're not super common, but it does happen. So what is it? Well, mycobacteriosis is the disease caused by the bacterial organism Mycobacteria. And Mycobacteria is actually a genus, so it's a big group of different types of bacteria, and there's lots of different species of Mycobacteria. And what people know about more commonly causing disease are both the organism Mycobacteria tuberculosis, which causes the disease tuberculosis, and then Mycobacterium leprae, which causes the disease leprosy. And so those are the diseases we know about more as humans because those are diseases that can affect us. And so oftentimes people will know, oh yeah, I know about the disease tuberculosis, or yeah, I've heard about the disease leprosy, but it's caused by a bacteria called Mycobacterium. Mycobacterial organisms are actually, there's tons and tons of them. For all the people who are into the science out there, they are a acid fast staining bacilli type of bacteria. They're aerobic, meaning they like to grow in air. They're slow growing, so they have a very kind of long persistent disease when they cause disease. And they're really resistant to lots of environmental extremes. So they can withstand like a lot of drying, they can withstand lots of moisture, they can withstand heat, they can withstand cold. They're really pretty amazing bacteria. If you're into bacteria and think bacteria are cool, they are actually quite an interesting organism because of how how much they have evolved to deal with living in different environments successfully. In living in different environments quite successfully, they also are quite successful at causing infection in a lot of different species. So I have a list here of some of the species, and this is not a full list. This is just some of the species that have been found to have infections with different mycobacterial species. I have humans on the top of the list, again, that Mycobacterium tuberculosis or Mycobacterium leprae, being the common organisms that we'll see more frequently in people. But people can be infected with different types of mycobacteria as well. Cattle, sheep, real exotic things like bears, giraffes, rhinos. All of these animals have been found to have mycobacteria at different points. Different reptiles, hamsters, amphibians, fish. In fact, I had a fish tank with cichlids, and one of my cichlids had mycobacteria, so it's out there. Oftentimes we're not thinking too much about the different infections that affect our fish, but there are certain diseases that cause them problems too, just like anybody else. And then what we're more interested in today is the birds. Birds have absolutely a variety of different species been found to have mycobacteria infections. So looking at the birds, what species of mycobacteria that they get? Well, it's usually Mycobacterium genovens or Mycobacterium avium, but there have actually been 10 different species of Mycobacterium that's been identified in birds. So, it's really important for us when we talk about mycobacteria to recognize that mycobacteria is not just one different type of organism, there's many different species. And so we don't worry too much about Mycobacterium tuberculosis in birds, though it has actually been documented to transfer from people to birds before. That actually there's reports in the literature of that occurring. In them, it's much more common, though, that we see these other species that are not as common in humans, but do absolutely happen in humans too. These particular species in humans are more documented with people who are immunocompromised as opposed to people who are not immunocompromised. So, because our immune system is supposed to be fighting off any types of bacterial or microbial organisms that enter into it, and we may be exposed to some of these things as humans, but we may not necessarily get them because we have a robust immune system that's able to fight things off. And vice versa for the birds too. The Mycobacterium tuberculosis, you don't really hear about a lot of people transmitting Mycobacterium tuberculosis to birds. If a bird has a good immune system, it should hopefully be able to fight things off. But there have actually been studies that show that people have transmitted it to birds. Now, important thing for us to just briefly mention is because these are infections that could get into people, if a bird has them, it is possible that a person could pick it up from a bird. So if your bird gets diagnosed with mycobacterium, and it's one of these organisms, in theory, you could, as a human or someone in the house that's exposed to the bird, could pick up mycobacterium from the bird. But as of to date in the literature, there's actually no documented reports of birds passing mycobacterium onto people, but there are reports of people passing mycobacterium onto birds. So it's just interesting because I think a lot of people worry more so about getting something from their bird, which is natural for people to worry about that sort of stuff. But in fact, it's more sometimes that we're the problem for them, at least what's been documented in the literature anyway. But even still, it's something that if you have a good immune system, if your bird has a good immune system, these often aren't a huge problem. So what kind of pet bird species do we typically see this in? Because this can be seen in a variety of different species. It's been documented in tons of different bird species. But there are certain parrots that it's been documented more frequently in than others. So the budgerigar, common little pet bird that lots of us have or have had at some point in our lives. The Bajaragar is one of the species that it has been documented a little bit more frequently in, and then rotogerid parakeets. So these guys are not as common in the pet bird population as they used to be. They used to be more common than they are now. But the rotogerid parakeets were actually documented quite a bit more frequently than other species to get mycobacteria. And there's a part of me that wonders, of course, I don't really know, but there is a part of me that wonders if maybe the reason the rotogerids are not as commonly kept anymore is maybe because there were a lot of these individuals that had mycobacteria, maybe were more affected by it and didn't do well in captivity with it. I don't know, just a thought. But Amazon parrots, Pioneus, and then cockatiels also have been ones that are more commonly reported in the literature. Some of these things, when we look at these individuals, some of them, it's hard for me to say like, oh, an Amazon's way more susceptible to mycobacteria than a macaw. I don't know that that's actually the case. Sometimes I think it's more just a function of, well, Amazons, first off, when we say Amazon parrots, there's, I think like 32 different species of Amazons or somewhere around there. So first off, that's covering a lot of different species of Amazons, number one. And number two, Amazons are a common parrot. Bajaragars, cockatiels, those are all common parrots. So maybe that they're more frequently seen because they're more commonly kept as pets, as opposed to it really being that is more common in them. But then when you look at the protogerids, again, you don't really see too many of those. I honestly think I only have a couple of clients that have protogerid parakeets as pets. And so in them, because it's way more documented in them, but we really don't see them frequently, maybe there is something to that particular species truly having a problem with it more than some of these others that I have listed here. Okay, so how exactly does it cause a problem? How does mycobacteria really get into these birds and actually induce problem with them? How does it cause disease? Well, interestingly, I think a lot of people will often, because we talk about mycobacteria tuberculosis, and humans know a little bit more about that because it's a problem more in humans, the tuberculosis. Tuberculosis, we know, is more of a respiratory thing, like people cough up exudate from the lungs, the trachea, sputum sort of stuff, and can transmit it to other people through coughing, and it likes to hang out in the respiratory system. That's where Mycobacterium tuberculosis wants to hang out. And when I talk to owners about, oh, I'm worried your bird could potentially have Mycobacterium, and they go, well, what is that? And I'm like, well, Mycobacterium is a type of bacteria, a more common organism within the same genus is Mycobacterium tuberculosis. That causes tuberculosis in humans. And then they go, oh my gosh, is this going to cause respiratory problems in my bird? Or they say, no, that can't possibly be what's going on because my bird has no respiratory signs whatsoever. And the difference is that it's not as common to cause respiratory signs in birds because it's not really transmitted in that way. So it's not, birds are not picking it up from other birds because they're coughing it up. They actually have it more in their gastrointestinal tract. So birds pick it up potentially more in the environment because it may be more in the environment in some place, and a bird goes and ingests it orally. So they pick it up with their beak. And that's the more likely place where they get it, is they ingest it as opposed to inhaling it. And when they ingest it, it's going to go down into the gastrointestinal tract, right? So it goes in the oral cavity, goes down the esophagus into the crop, and then travels down the crop into the proventriculus, ventriculus, and then into the intestines. And for parrots, it seems to hang out more commonly in the intestines as the main site where it first infects, but then it actually will move from there to other parts of the body. And it probably spreads to other parts of the body from the intestinal tract through the vascular system, because when we eat things, right, we're breaking down the nutrition from a food item, and we absorb the nutrition from the food item into the vascular space, and then it moves around the body to go to different organs and everything, right? Well, when you ingest a bacterial organism, it may locally infect the GI tract first, but then it could penetrate through that GI tract, get into the vascular system, and circulate around the body, and then decide to go into different parts of the body based on, wherever it decides is a happy place for it to hang out. It does tend to go to the liver and the spleen as two very common sites that it likes to hang out in. And then it also can go to the bone marrow. And really, when you're thinking about the blood, I mean, blood is circulating all throughout the body, right? So it can really kind of go anywhere that it wants. It's just those are sort of the more common sites, liver, spleen, and then bone marrow. And then other organs can be affected too, because again, your vascular system is all throughout your body. So it can also go to other organs like the conjunctiva of the eye. It can go to kidneys, it can go into muscles, it can go into the reproductive tract, it can go into endocrine organs. I mean, it can go in different places. It certainly can go into the respiratory system. It's not that it is impossible for it to go into the respiratory system. It's just that when we look at birds who have had the infection and where it is in the body, it's just less common in the respiratory system. So while owners often get worried about it causing respiratory things, it often isn't going to cause respiratory problems. It can, but it often is not going to. Once it gets into a particular organ, wherever it decides it wants to be, they usually cause a particular change in that organ. They cause something that's called a granuloma. So when we look at a sample of a tissue underneath a microscope, because we're looking for this bacterial organism and it's microscopic, we have to take tissue samples and look at them underneath a microscope. What we'll see is this basically pocket of inflammatory cells that are trying to attack the mycobacterial organism. And when you get all these inflammatory cells together, it causes a granuloma. Oftentimes these granulomas have a necrotic center because you have this bacteria that gets into the wrong part of the body. The body recognizes that there's some bacteria there that it does not want there. The body goes, hold on a second, this is a problem. I'm going to send all these inflammatory cells to try to get rid of this organism. But by whatever mechanism that mycobacterial organisms have developed over their centuries on this earth, they have been able to evade the immune system to some degree, but the immune system is still trying to get at them, and they will produce different types of inflammatory cells as the infection kind of sits there and persists. Because these are, as I said, these are slow growing organisms. They like to hang out for a long period of time. These are not something that's a quick infection. It's not like you get a mycobacterial infection and it's a rapid thing. The way we get a cold or something where we're around somebody who's sick and then the next day we feel sick. That is not the case at all with this particular organism. This takes probably weeks to months to years before it starts to truly cause problems, because it just takes so long for it to grow and develop. But that immune system is trying to attack it for all that time. So it sends these cells that are typically more ones that we see with chronic inflammation, macrophages. They convert to something called giant cells. Heterophils are a type of inflammatory cell that's present more in the acute phases of an infection, but they'll still hang around too when they're trying to deal with this chronic thing that's been going on. It's just the macrophages kind of take over. So again, like I mentioned, this is something that we look at underneath a microscope to see the actual organism itself. And if you take a sample from a patient and we look at it underneath a microscope, we usually have to do a very specific stain to identify the organism. We do what's called an acid-fast stain. There's lots of different stains that microbiologists use to help highlight different cells in different ways and really give you an idea of what is actually going on at the cellular level. And for this particular organism, it stains well with something called acid-fast. And when we look at this picture here, this is just where's my pointer? There we go. This is a microscopic evaluation of a sample. All these little blue things, these are just the nuclei, so the central portion of the cell of the patient. But then all this pink stuff that's all around, all that pink stuff is acid-fast organism. So this is hundreds or thousands of all these little pink things being mycobacterial organisms present. When we look at this picture over here, this is a very particular type of acid fast called the Phytes acid fast stain. All the little like purpley pink sort of dots, these are all acid fast organisms, so all mycobacterial organisms hanging out in this tissue sample. And in this sample, it's not stained with acid fast, so we can't see the mycobacterial organisms as well. This one stains differently, so we are not seeing as much blue as we were before. We're seeing pink, but it's a different stain, so it's not actually, the pink is not associated with the mycobacterial organisms. The reason I put this picture up instead is because I want to show what a granuloma is. So when we look at this picture, this is a sample of a conjunctival mass on a bird, which I'm going to get into a little bit more in just a moment. But a sample was taken from a little lump on a bird's eye, the like pink part of a bird's eye, sent off for evaluation. And under the microscope, they saw this actual edge here, where you kind of see this nice little pink or purplish sort of strip. This is normal epithelium, so it's like the normal surface covering of the tissue. This like pink and purpley sort of spotted here area, that is normal subcutaneous tissue. So from this purple tip to here, this is all healthy, normal tissue. Now, what you'll notice over here are these big sort of purple globs kind of taking up the rest of the sample. There's like a little bit of pink strip, normal, healthy tissue here, a little bit of pink strip, normal, healthy tissue here. Everything else is these big blobs of purple. These are granulomas. So these are these like packets of bacteria in there that we can't actually see because the stain isn't correct for it, but bacteria is mixed in there. You've got your inflammatory cells mixed in there. There's dead stuff, dead cellular debris accumulating, and it's really causing a mass effect on this sample on the bird's eye where we took the sample from, because it's just packed full of inflammatory cells, bacterial cells, exudate, whole bunch of gunk that's not helpful at all, and it's really pushing out all the normal tissue to its extremes, essentially. Okay, so what are the signs that we see associated with mycobacteria? We know what the organism is. We know how it gets into the body, how it spreads around to different organs. It kind of hangs out in those different organs. It takes a while before they start to cause changes, but it causes all these inflammatory cells to move in and causes these granulomas. So what do we actually see in our pet bird that is dealing with this particular infection once it starts to cause a problem? Well, the annoying thing is it's very non-specific. So there isn't some very concrete, like, oh, your bird has this particular sign that is definitely something we see with mycobacteria. The signs that we see are really, so many different things can cause them. One of the most common things is just lethargy. The bird's just quiet. It's just not acting right. It feels sick, so it's acting quiet. It's not moving around as much. That's one of the most common things that's seen. Other common problem is weight loss. Because the body is dealing with this chronic disease process, well, when your body is putting all its energy and resources into trying to deal with an infection, it's not uncommon for an animal to lose weight. So weight loss is something that we'll see. Or a bird, the owners may not recognize it lost weight because it's a chronic problem, it is a slowly progressive thing. So this bird's slowly losing weight over, again, weeks, months, years. And so they don't recognize it a lot of times until they come into the office and we put them on the scale and we go, oh my gosh, she's really underweight. Or I feel the pectoral muscle mass and the keel bone is very obviously prominent. That's always sometimes, or not always, but it sometimes is something that is a little difficult for owners to see, because the feathers are all big and fluffy and they don't recognize sometimes that the muscle mass underneath all those feathers is kind of shrinking down and wasting away because of weight loss. So if your bird lets you feel over the keel bone, it's a good thing to feel to make sure that you don't feel that keel bone being too prominent. You should feel it a little bit, but it shouldn't be like, this huge mountain peak of it being like really, really prominent. Another thing that might happen with birds that have this problem is a distended abdomen. Now, why does that happen? That happens because as I mentioned, the infection gets into the liver, it gets into the spleen as like the two big sites that it likes to go to once it's past the gastrointestinal tract. And it can make that spleen become really big. It can make the liver become really big. And when you get this really big spleen or big liver, then your abdomen gets really distended because now this big spleen is taking up more space, or this big liver is taking up more space. So it pushes other things out of the way, and they have this big sort of pendulous belly. They may have diarrhea because, again, it likes to affect the gastrointestinal tract. So that organism may interfere with nutrient breakdown. It may interfere with nutrient absorption. In that process of losing weight, they may also develop diarrhea because they're just not getting nutrition the way that they should, or assimilating it, breaking it down, what have you, the way that they should. Weakness, which kind of goes along with the lethargy. If you're not getting the appropriate nutrition that you need to be, if your body's really focused on dealing with all these granulomas that are developing in the liver or the spleen or the bone marrow or wherever, they start to feel weak because they just don't have the energy, because all their energy is being put into inflammation. I've had patients come in with the sign of they were falling from the perch. And when we evaluated them, we saw things that made us go, okay, the bird's underweight, or has a distended abdomen, or other things that make us say, okay, this bird is a suspect for mycobacteriosis. But the only sign the owner noticed was it fell from the perch, and that's what brought it into the hospital. That's happening because the bird is weak, right? And then even seizure activity. I have one patient currently who just finished up with medications for mycobacteriosis, who he originally came into the hospital because he was having seizures. And I will say, we see birds with seizures quite frequently, and Mycobacteria is not a common cause for seizures, but in that particular individual, it was. And it was most likely because the bird had the infection in his liver. His liver was really poor at the time, not functioning appropriately. Plus, he may have also been having other systemic changes that put his body into a state where something like a seizure was able to happen. So most of the time, birds coming with seizures don't actually have this particular infection causing the problem, but it has been something that has been recognized as a sign that an owner noticed at home that caused them to bring the bird in for evaluation. Now, specifically in cockatiels, this is kind of interesting, I think, and there's a lot of people that have cockatiels out there. They're great little birds. There's a syndrome in them where they actually get the organism in the tissues around the eye, and it causes the conjunctiva, or the pink part of the eye, around the eye, to get really swollen. So I had mentioned earlier when we were looking at the microscope slides of what mycobacteria actually looks like, that they had come from a sample from a bird that had a swelling of the third eyelid. This particular bird, this was not a photo of mine. This is from another doctor, and they had a bird come in, a little cockatiel that they were smart enough to take a picture in. I often am really bad about taking photos. I have had a few cockatiels like this, but I'm just not the best when it comes to photo taking. I often forget. But they did a great job of taking this photo because it's a very good photo. Here's the bird's eye, but you can see this swelling of the conjunctiva is quite prominent. That's a big concern in a cockatiel. Now, it's not always mycobacteria when we see this, but it is one of the main things I'm thinking about when I see it. I can also see this associated with chlamydia. I can see it associated with mycoplasma, which is a different type of bacteria. Sounds very similar. Mycoplasma and mycobacteria, two totally different organisms. Mycoplasma can cause this, just like mycobacteria, the organism we're talking about today. So it can also happen sometimes just from irritation. Like if there's something in the environment that was irritating to them, it may cause the conjunctiva to become really swollen and prominent. So not a slam dunk diagnosis of, oh my gosh, you have mycobacteria when you see this in your cockatiel, but it is something that if you see this in your cockatiel, definitely need to get your cockatiel checked out by a veterinarian. And we often have to biopsy these to truly know what's going on. But it is a thing in the cockatiel that they will get this conjunctivitis with mycobacteria. All right, so let's say your bird is showing some weird signs. We don't know how this organism works now. if the bird comes into the hospital, what are some things that we're going to do to try to diagnose this? Because again, as I mentioned, this is a non-specific disease, the signs that they show. There's many other things that can cause very similar signs to what the bird is presenting with. So we have to do some diagnostics to really try to figure this out. And this is a frustrating disease because this one, again, it's this slow growing, this chronic thing. It causes changes in different parts of the body, and you don't always get this nice, easy diagnosis right away. It often is a diagnosis of exclusion. I often am excluding a lot of other problems to come to the conclusion that this is probably what we're dealing with. Now, we'll often start off with real basic diagnostics like we've talked about before: CBC, chemistry, and some sort of imaging. The CBC is what's looking at your red cells, your white cells, your platelets or thrombocytes in birds. What we will often see with mycobacteria, but not always, is going to be a high white cell count. I absolutely have confirmed cases of birds with mycobacteria that the white cell count didn't change. Why? Maybe because it was in the more chronic phases where the inflammation was in the tissues but not systemically going on. I don't know. But if we have a bird with a really high white cell count, this is one of the diseases I'm going to be thinking about. Maybe there's some changes to the red blood cells, but it's much more likely it's a high white cell count that you will see. On the chemistry panel, that's the part of the blood work that is looking at your liver function, your kidney function, your electrolytes, your calcium levels, fat levels. It gives us a good idea of just basic, like, sort of systemic health going on with the body. And you may, on your chemistry panel, see high liver values. Not always. If the liver is not affected by this particular infection at that time when you drew the blood sample, liver values may be totally fine. You might see kidney problems if the kidneys are affected. But again, kidneys aren't as commonly affected with this disease. So if I see a bird with kidney values being elevated, not the first thing that I'm thinking about, but it is possible. There's possibly other enzymes that change in the body when this process is going on with when mycobacteria is causing issues. So maybe you're going to see some other changes on the blood work, but it's again not specific. And then we often want to do some sort of imaging. Most times we start off with x-rays because x-rays are quicker, simpler, don't necessarily require sedation or anesthesia. Of course, that depends on the individual bird, that depends on the individual doctor who's working with the animals, but they're usually a more quick thing to do. And we might see something on an x-ray like an enlarged spleen, an enlarged liver. We may see some dilated gassy intestines. The CT scans are definitely more, give us a lot more information. They're a more advanced imaging that can be done that's super helpful because, you know, when we take x-rays, we're taking this three-dimensional being and we are squashing it down into 2 dimensions, and we're usually only taking like 2 views. And a CT scan takes like the whole like animal, and it takes x-ray like multiple times along the length of the animal. So it takes like 800 x-rays essentially. And then the computer compiles it together so you can make this nice 3-dimensional rendering. And so we actually get way more detail and information with a CT scan. And we're able to also usually do contrast that we give intravenously that helps to highlight different organs and tell us what's actually enlarged. Because sometimes I'll take an x-ray and I'll just see this big white thing in the abdomen and I can't tell what's going on. I'm like, is that a big liver? Is that a big spleen? I'm having a hard time telling. The CT with contrast is much more detailed and tell us, oh, hey, you actually have a big spleen, or you actually have a big liver, or you have big both, or maybe you have fluid, or, you know, different things that could potentially be going on. So the CT is way more helpful. The issue with the CT is it's more expensive, and it does require them to be under anesthesia because they can't be moving. Sometimes you can do really heavy sedation for them, but it does require some level of them not being fully conscious. So there could potentially be risks associated with that depending upon how sick the bird is when they're presenting. So it may not be something we want to do right away. So here's an example of a bird. This is a canary, and this is a canary that I diagnosed with mycobacteriosis. So even our tiny little birds can get this disease. Now, first, we're going to look at this bird over here, because this bird over here is a normal canary. it has been given a contrast agent. So this bright white stuff, that's actually barium. That is something that we can give to birds. They swallow it. So he got it orally. He actually has a little bit in his beak still, because this is his beak up here. He's got a little bit inside his mouth still. It's going down into the crop. It's going down the thoracic esophagus into the proventriculus. This is the ventriculus, and then looping through the intestines. The point of doing these contrast barium x-rays is it helps me identify where the GI tract is, if there's any dilation of the GI tract, but then also what other organs are in what locations, because with this disease, as you get those granulomas within different organs, it pushes the organs in different ways, and how it ends up pushing the GI tract one way or another may help me to define if there is an enlarged liver or spleen or what have you. So this particular image is a normal canary. This is what a normal canary is supposed to look like with contrast, and I actually took this image from online. These other images here are a canary with mycobacteriosis, and this was a patient of mine. So these are my own images. We originally took these x-rays of this patient. These are without any sort of contrast. These two images over here, this is called a VD radiograph, and this is a lateral radiograph. When I took these x-rays, you can see how big and bulgy this poor little canary's abdomen is. And when we look at this x-ray compared to this x-ray, notice how like wide and like fat this canary looks. Like, see how much bulging there is to this canary's abdomen compared to here, where this canary is a little bit more lean and thin. And what you'll notice, this is the edge of the heart up here, and then the edge of the liver comes down. This is like ballooned out totally wide. When we look at it over here, this is where the heart sits, so the edge of the heart, and then the liver comes down here on either side. And you can see way more space between the chest wall and the liver on either side, as opposed to my patient. Here's the chest wall, here's the liver. Like, there's not as much space here. So that's air sac space. Something is big in this poor little bird's abdomen that's taking up more space than it actually should. So what did we do with this bird? This bird, we gave some barium so that we could have some level of contrast and get an idea of where the GI tract was, if the GI tract was dilated or abnormal in any way. And then if the GI tract was displaced in any way, to help me identify any sort of organ enlargement. So this is the proventriculus of this little bird, the ventriculus, and the intestines filled with barium. This is the like a little portion of the crop, the thoracic esophagus. This is the proventriculus, ventriculus, and then again you have loops of intestines. Based on where this proventriculus and ventriculus, so the stomach of birds, is located, I can see it's being a little bit more displaced to the left than it should be. If we look at our normal canary here, you see this here, this white line, that's the keel bone. Look how much space is between the keel bone and the proventriculus in this bird, versus my bird over here. Here's the keel bone and the spine, and how much more space there is between the keel bone and the proventriculus. It's getting pushed over to the side a little bit. I didn't pull a normal lateral image. I should have, but I didn't think to. What I can tell here is, here's the proventriculus and the ventriculus. Normally, the ventriculus comes down and kind of touches right against the skin, and it's not. It's kind of pushed up a little bit. The only thing that lives between the heart and the proventriculus and ventriculus region is the liver. So this is an x-ray that is highly suspicious for a bird that has an enlarged liver, not only because it's really wide over here on this image, but because the proventriculus is kind of pushed up and the ventriculus is pushed up a little bit more than it should. Now, that could also be fluid that's in there, and that's where we might do things like an ultrasound to look for fluid, or ultrasound to see if it is truly the liver that's big. Or if we wanted to do a CT, that would be an option as well. But just kind of show you guys what it looks like when you have a bird that has this infection in its liver. It's just caused that liver to balloon out so much and is pushing other organs out of the way, and pushing on the air sacs. Like, this bird did have a little bit of respiratory distress, not because it had the organism in the lungs, but because the abdomen was so big and the air sacs were getting pushed off on that, it just didn't have as great of air circulation and flow throughout its body the way it's supposed to. Now, the CBC, chemistry, radiographs, those are non-specific diagnostics. Those diagnostics are very broad. They're casting a broad net, essentially, to see what can we find that helps me to know what could be going on. Because again, a lot of these signs are non-specific, and there's a variety of different diseases, processes that could be going on that look just like this in the beginning stages. When I am suspicious for mycobacteriosis based off of my initial diagnostics, I may want to do more specific diagnostics. And the specific diagnostics, the best one to do is take a biopsy of the affected organ that looks abnormal. Problem with this is sometimes it's a bit invasive. Now, it could be simple. If it's like that cockatiel, let's go back to this little bird here. If it's like this cockatiel and we've got this swelling that's just there in the conjunctiva, that's easy for me to take a sample from. I can easily put this bird just briefly under anesthesia, take a small biopsy of this. It's immediately available right there. It's not going to bleed very much at all. This is something that's easy for me to collect. Now, if you've got a tiny little canary and we're worried about potentially a liver enlargement, then that might be, because of mycobacteriosis, and I want to take a sample of that liver. Ooh, that's a little bit harder in a tiny little canary. So I may be a little more hesitant about getting a sample from the liver. If I have a bigger bird, I will. If I have a bird that is a like an African gray sized bird, and I mean I have actually gotten biopsies in birds as small as finches before. I've gotten a biopsy from the liver in a shaft-tailed finch, but it's not usually the first thing I'm going for because they're tiny and it's a little bit more delicate, and we want to go to that sort of diagnosis when we don't have any other options available to us. But in a medium-sized bird, it's a little easier to get to the liver, so I may be more likely to recommend it to an owner who has an African gray than an owner who has a budget, initially, I should say. But that's where we really get our answer. We take a biopsy of the organ that is affected. We do one of the following diagnostics that I have listed here. We do either acid-fast staining, which is what is showing on the a microscope here again, where we have the special stain that highlights all these little pink things. Those are all the mycobacteria organisms. So it's helpful, but I will also say it's not always the best yield because sometimes there's just granulomas in an area and the mycobacteria is gone and it's somewhere else. And maybe I took a biopsy of this one spot where the bacterial infection isn't present anymore, but it was swollen and irregular and odd looking because there was granuloma in that tissue. That's not so helpful when I can't diagnose it on that sample because the organism's gone elsewhere. But acid-fast staining is one of the first things. We can also do what's called PCR, which is where we're looking for the DNA of the organism. It's really quite a helpful thing. But the gold standard way to get a diagnosis is doing a culture. At least that's what's based on the literature. I suspect that probably maybe that'll change in the near future, where PCR kind of outcompetes culture as the gold standard. But according to the current literature, it is still the culture that is the way to diagnose it. So you get your little biopsy sample of the affected organ and you send it off to a lab where they can do culturing, or you send it off to another lab where they can do PCR, or send it off to another lab where they do acid fast. You can send it to different labs that do different special things. The cultures, because these are organisms that have the potential to be zoonotic, again, that means people can pick them up, it has to be sent to a very specific lab. Not all labs are going to do a culture for mycobacteria. There's a very specific lab in the United States. It's called the National Jewish Laboratory. They're the lab that does the cultures for mycobacteria. So if you want a culture for this, you have to send it specifically to them. That is the gold standard thing to do. But again, PCR in time may outcompete that, and we may find that that's actually the better diagnosis. Who knows? Time will tell as the science changes. I already mentioned it a few times, but important to note again, we're going to talk about treatment, but before we talk about treatment, I just have to have a warning that there is zoonotic potential with this particular infectious disease. So I may have a bird come in with specific signs. I am worried about mycobacteria based on its signs, based on tests we do. I may recommend we go do a biopsy. We do a biopsy and bam, we get our diagnosis. This bird has mycobacteria. Before we talk about treatment, I have to talk about zoonotic potential with owners. If I don't, well, that's doing a disservice to the owners. It's also, something that ethically we have to do, because we have to talk to the owners about, could this potentially be a problem for you? And again, it is a potential disease that people could pick up. It is not been diagnosed or documented as of yet to have transferred from a bird to a human. It has been documented the other way, from humans to birds. That is in the literature, that is documented. But even though it hasn't been documented to be transferred from a bird to a human, because it's a mycobacterial organism, because we know that people can get the most common organisms that we see, the Mycobacterium genovens in birds, we know that people can get those when they're immunocompromised. You know, we don't want that person, that pet owner, to be, you know, case number one that's in the literature that says, oh ha, well, this person is the one who came up positive from their bird. So we have to talk with owners seriously. You could potentially get this. Do you want to treat your bird? If you treat your bird, know that you could potentially pick this up. Know that you need to take special precautions in your cleaning and handling of the bird, so that you don't pick it up. And, you know, the precautions are general things that we would be recommending anyways. Don't let your bird, you know, eat food from your mouth, or kiss the bird too much so you're having a lot of like beak to mouth contact. Be mindful of how you're cleaning things. Don't get any bird poop on your hands and then go eat food, not wash your hands. You know, it's stuff that is regular, appropriate cleanliness. Clean up after your birds, wash your hands, especially before you eat your food, you know, all that sort of stuff. But do know it could potentially be infectious. So we'll move on. What do we do when we actually have a bird who has this infection? How do we treat it? Well, we really actually follow the human literature for this. So in people, because Mycobacterium tuberculosis has been a thing that's been around for centuries, and it is something that there's a lot of data on the human side to show like what antibiotics are going to be helpful, how long you need to treat, potential for antibiotic resistance issues to develop. What we have learned from the human side of things is usually to treat these infections, we need to do combination therapy with antibiotics. So it means that we're not doing just one antibiotic. It usually means we're doing anywhere from 2 to 3 antibiotics for birds that have this particular infection diagnosed. Again, the other thing too we have to talk with owners about is it takes months to years to treat these animals. And they really may not truly resolve an infection. They may just be in remission. People with tuberculosis, you know, they may be on antibiotics for a long period of time, combination of antibiotics. They may be at a point where they are deemed that they are in remission, but may not truly be resolved. And that means that it could potentially pop up again later on down the road. You know, we haven't found the silver bullet perfect medication that gets rid of this infection totally to where we can go, ah, you are completely clear to this, everything's fine. These are suspects for the future. If something goes wrong, we need to consider this after they've been through a course of treatment for this. Also, I should mention on the antibiotics that we usually use for them tend to be ones that aren't used frequently with other infectious diseases we see more commonly. Some of them are. It depends on what sort of regimen we want to do, but there are a lot of heavier duty antibiotics that we use for this particular infection. Other things that are important to recognize is that the bird may need additional supportive care depending upon what part of the body is affected with this infectious agent. If we have the liver being affected by mycobacteria, okay, we treat them with the antibiotics, right, to get rid of the organism, but they also may need some liver support too. So maybe milk thistle. If they are really underweight, they may need some nutritional support with assist feedings. If I'm worried that the GI tract could potentially have some sort of irritation to the mucosal surface, I may be putting them on certain anti-ulcer medications to support the GI tract. Anti-inflammatories may be needed as well. Again, there's a lot of inflammation as part of this disease process. So we may be putting them on the anti-inflammatories for at least a period of time. When it's causing a conjunctivitis, like in that cockatiel where we get this like big bulging, you know, we may need to do some topical anti-inflammatories, topical antibiotics, things like that. I cannot emphasize it enough that these are chronic cases. These birds will require a lot of follow-up with a veterinarian when a bird has been diagnosed with it. I've actually had some owners get mad at me before when I'm like, okay, here we're diagnosing you with this and I need to see you back, you know, to really be following up. And when they come back for their follow-up, I'm like, okay, the bird's doing great, but I need to see you back. And after a while, owners do start to get frustrated because nobody likes going to the doctor all the time. I totally get it. I don't want to go to the doctor all the time either. But this is something that right up front, we have to recognize this is going to take a while to deal with. This is going to take, you know, a lot of time treating, going back for follow-up tests to see if our white cell count is improving. Is our liver size going back to normal and spleen size going back to normal? Are we making improvements the way that we expect? Because if we're not, then we might need to change our medications. We might need to swap things around. So one of my patients that I just got off the medications, that was a Mycobacteria patient. I think we were treating him for about 2 years, and he just finished up with his medications. And he was having to come about every 3 months or so for us to check his blood and take x-rays to see how things were progressing. Initially, up front is when you're going to be seeing the vet the most with this particular disease. You may be initially even having to hospitalize the bird, and then maybe they're going to be coming in every few weeks, and then every few months, and then after that, maybe you're going to get to the point where you get to like 4 months, 6 months follow-ups, you know, that sort of thing. It just depends on the individual and how they are doing, but this will take a while. So, you know, basically, the conclusion here is that it is a difficult disease to deal with. The diagnosis, number one, is difficult because getting to the point where you take a biopsy of a particular organ, it's not always easy to get to that organ to biopsy it. There may be, there's risks sometimes associated with it that maybe we don't want to take those risks, you know? So sometimes getting a concrete, yeah, we've got our diagnosis, definitive diagnosis, sometimes that's difficult and takes a while to get to. We're often needing to rule out other diseases. It is a difficult disease to treat because it takes a while for medications to really be effective against it. And then they have to stay on medications for quite some time. And, you know, it's difficult to manage because it, again, takes months to years of these birds being on medications. It's not impossible to treat this. I absolutely have some success cases. I have some cases that weren't success cases too. So it's something that you have to have a good relationship. If your bird has this, you have to have a good relationship with your veterinarian, an understanding with your veterinarian of what the plan is, what we're going to do with this individual, how are we going to manage this problem, you know, and do the best by the bird in the long run, and do the best by the family too. Because, you know, I also have been in the situation where owners don't want to take the chance because of the zoonotic potential, and sometimes you know, that's okay. That's an owner individual decision that is made because maybe there is an individual in the home who's immunocompromised, and we just can't take that chance, you know. And so then sometimes we're having to think about humane euthanasia, you know, for the bird, which is always a difficult topic and thing to discuss and do, but we also don't want the bird suffering with this disease when you have a huge liver, spleen, you're having such severe problems with it. So, you know, sadly, sometimes those are the decisions we need to make too. But if you're going to go forward with treating this, you just have to really have a good relationship with your veterinarian, again, to really help guide you through this process when a bird is diagnosed. So I believe that is the last of my PowerPoint. I'm happy to take any questions.
Okay, yeah, we do have a couple questions, a few questions. So first question is they have a flock of 15 European goldfinches that in their garage setting, and then one just died and was necropsied, and it had decimated Mycobacterium genevents, was isolated. So
Yeah.
the person with the question is pregnant, and they also have a 2-year-old. So they obviously have a newborn and a 2-year-old in the household. And their husband handles the birds, not them. And they want to know, so a poultry vet has recommended culling all the birds, while the companion avian vets have recommended an N95 mask to test the sick ones, and there's no need to cull. So they're curious what you would recommend. The birds are highly regarded, but priority is obviously to the family and their kids. Yeah.
Yeah, that's okay. So it's difficult, and this is something where it's you know, different people may have different opinions. Ultimately, it has to come down to what the owners want to do. I put a picture of a finch on here because finches are one of the ones that I personally diagnosed it more commonly in. And in fact, one of my own finches was diagnosed with Mycobacterium genevents. I can tell you what I did with my own personal flock. Now, I don't have children. I don't have anyone immunocompromised in my house. But what I ended up doing when I found that one of my finches, and she had passed away, and I had found it after she had passed away, I recognized that, okay, the rest of the finches in the flock, they very well could have this disease. This is a hard disease for me to diagnose. While I could do the sampling of a poop sample on all individual birds and do the acid fast staining or the PCR test, the stool sample isn't the best test. There's actually an older paper. So if somebody were to repeat this, the values might be slightly different, but there was an older paper that showed only 5% of the time that a bird has mycobacteriosis will it pop up on an acid fast staining of the poop, and only 20% of the time will it pop up on a PCR of the poop. That's really poor testing. I mean, you can do it, but if you get negatives, doesn't mean that you don't have that disease. So what I decided to do with my flock is I decided not to do the testing because of those poor statistics. And I elected to say, this flock is my quarantined flock. I decided to not euthanize anybody. I did take one individual from the flock. I did do health screens on everybody. Like I just did physical exams. I did x-rays. I had one individual who had a big liver. And that's when I had said that I've done a biopsy on a shaft-tailed finch. It was my shaft-tailed finch that I did the liver biopsy on because I'm the vet, so sometimes I am a little more gung-ho about doing things for my own and take a little bit more precaution sometimes with owners because I know that like when I did that biopsy on my finch, I could have lost that bird when I did it, but for me, I decided that I wanted to do it. I did a liver biopsy on him because he did have a big liver on x-rays, found out that it was not mycobacteriosis. He had another liver problem that I started treating him for, but I also knew maybe mycobacteriosis isn't in this particular location. So I treated him for his liver problem, and I housed all the rest of the finches with him in sort of the quarantine cage. That cage is in a different part of the home. I do their cleaning and feeding and all that stuff separate from my other birds. And whenever somebody died in that flock, everybody got necropsied. So, whatever disease process they passed away from, I necropsied every single individual because I wanted to see, was it still in the flock? Interestingly, I didn't have it pop back up. Now I do actually still have 2 birds from that flock. So as they age out, I will eventually do a necropsy on them, but I never found it in anybody else. And I kept them quarantined. Again, it was they're fed last, they're clean last, all that sort of stuff. And it worked out okay. In a home where we have a young child young humans don't have the best immune system, they're developing their immune system, and a pregnant mother, that's a little bit more difficult. Absolutely, if you guys make the decision that you keep these birds, for sure, definitely the husband needs to be the one who's doing all the cleaning and everything and keeping these birds away from the rest of the family while you're in this stage of your guys' life. So hard for me to for sure say like, yes, go ahead and call them. No, go ahead and treat them. Absolutely something you guys need to think about. Personally, I made the decision to not call my birds and keep them, but manage them very much separate from the rest of the birds.
Okay, and the last part of that viewer's question was, does Mycobacterium genevis have vertical transmission in birds? I think you.
Oh, a great question. I don't think so, at least from what we know at this time. I mean, I guess it's always possible if a bird had the infection inside of the oviduct, which is, it can be in the gonads, it can be there. It's just not the common location for it to be. But if it was happening to sit on the ovary, or if it happened to be in the oviduct as that egg is forming and passing, yes, it could transmit that way, but I would say it's not a common way that is known to transmit. It's usually more horizontal transmission, meaning passed from it's passed in the GI tract, in the droppings, and it's transmitted to others that way.
Okay. Wow, that was we had a couple questions that well, if we didn't get to them, we'll get you an answer via email. That was very involved explanations. Thank you so much, Dr. Lamb, for walking us through this topic. This deep dive. These deep dives are amazing. I think this series is really helping bird stewards, really hammer home some of these conditions that we all should be aware of. So
Oh,
these,
well, I'm happy to help, and hopefully it's this is also because it's a zoonotic one. It's kind of one of those touchy subjects where it's like it can be kind of scary. I personally have had it not be so horribly scary. I do think there's ways we can work through this, but it absolutely is something that it's a conversation that needs to happen between an owner and their veterinarian to know what's right to do in that individual situation. So.
sure. And we talked, we were behind the scenes, we were talking about maybe having a whole webinar devoted to zoonotical diseases right?
Yeah.
So that's maybe a topic to cover. Wow. Okay. That was a fabulous presentation, and I got to announce. Sorry, Anna. I got to announce today's. We have a giveaway winner, and that's going to be the apple berries. That's the new NutriBerry product. It's the apple berries. Have you tried them, Dr. Lamia, with your flock yet?
Yeah,
Yeah.
I actually just tried some a couple weeks ago, and Arroyo and the flock did some filming. So I don't know, there might
Oh,
be
we can
something
see
in the
that.
future.
Okay. All right, we'll see that video hopefully next webinar or one coming up. All right, so the winner of the Apple NutriBrace plus another Lafeber product of your bird's choosing is going to Judith Riley. Congratulations, Judith. You'll get to try out the newest flavor of NutriBerries, the taste of summer. I'm calling it the Apple NutriBerries. Just sounds crisp and yummy. So,
Yeah,
all right. And Artemis, thank you for making an appearance in the webinar today. There we are. All right, Artemis, you stay local. Don't go.
right. No more exploring.
No more exploring. All right. He said she's using those eyes, for good. She's like, I can now see everything. I'm going for a
Yeah.
walk. All right, guys. On that note, thanks for joining us. We'll see you next time. All the best to your flock. Have a great weekend, everyone. Take care.
Bye.
Bye. Thanks, Dr. Lamb again.